Question 1. What is the medical term for surgical removal of the appendix? A. Appendectomy. B. Appendicitis. C. Appendostomy. D. Appendotomy. Answer: A. Appendectomy. This question tests your understanding of common surgical suffixes and the root word for a specific organ. The keyword surgical removal is the key clue, pointing directly to the suffix ectomy, which means excision or surgical removal. Therefore, appendectomy, combining appendix, with ectomy, surgical removal, correctly defines the procedure. For example, a patient presenting with acute abdominal pain might undergo an appendectomy. It's helpful to remember that many surgical procedures are named by combining the organ with the specific action suffix. Question 2. The prefix Brady dash in medical terminology means: A. Fast. B. Slow. C. Painful. D. Difficult. Answer: B. Slow. This question assesses your knowledge of common prefixes indicating speed or rate. The prefix Brady dash is consistently used to denote slowness. When you see bradycardia, for instance, it means a slow heart rate. Understanding these fundamental prefixes is crucial for interpreting patient conditions and medical reports accurately. A helpful way to remember this is to associate Brady with a break, which slows things down. Question 3. What does the root word hepat/o refer to? A. Heart. B. Kidney. C. Liver. D. Lung. Answer: C. Liver. This question focuses on identifying the anatomical structure associated with a common root word. The root hepat/o is consistently used in medical terms related to the liver. For example, hepatitis means inflammation of the liver, and hepatomegaly refers to an enlarged liver. Recognizing this root helps you quickly understand the organ involved in various diagnoses and procedures. Always connect common root words directly to their specific body parts, as they form the foundation of countless medical terms. Question 4. Which of the following terms means bone pain? A. Osteoporosis. B. Osteomalacia. C. Osteoma. D. Ostealgia. Answer: D. Ostealgia. This question evaluates your ability to combine root words and suffixes to define a symptom. The root word os/o refers to bone, and the suffix algia means pain. Therefore, ostealgia directly translates to bone pain. This is different from osteoporosis, porous bones, osteomalacia, softening of bones, or osteoma, bone tumor. When you see a term ending in algia, immediately think of pain as the primary symptom. Question 5. In anatomical terms, superior means: A. Away from the midline. B. Closer to the point of attachment. C. Towards the head or upper part of a structure. D. Towards the feet or lower part of a structure. Answer: C. Towards the head or upper part of a structure. This question tests your understanding of directional anatomical terms, which are fundamental for describing body locations precisely. The term superior always indicates a position above another structure or closer to the head. For example, the heart is superior to the diaphragm. Conversely, inferior would mean towards the feet. Mastering these opposing directional terms is essential for accurately documenting and interpreting patient anatomy in medical records. Question 6. The suffix itis in medical terminology means: A. surgical repair. B. Inflammation. C. Surgical removal. D. Condition of. Answer B. Inflammation. This question assesses your knowledge of a very common suffix indicating a disease process. The suffix itis is universally used to denote inflammation of an organ or tissue. For example, appendicitis means inflammation of the appendix, and bronchitis means inflammation of the bronchi. Recognizing this suffix immediately tells you that the patient is experiencing an inflammatory condition. This is one of the most frequently encountered suffixes in diagnosis coding. Question 7. What does the prefix hyper dash indicate? A. Below normal. B. Above normal. C. Normal. D. Within normal limits. Answer B. Above normal. This question examines your knowledge of prefixes that denote quantity or degree. The prefix hyper dash consistently means excessive, above normal, or high. For example, hypertension means high blood pressure, and hyperglycemia means high blood sugar. Understanding hyper dash and its opposite, hypo dash, is critical for interpreting many diagnostic terms. Think of hyper as being over the top. Question 8. The root word gastro/o refers to which organ? A. Gallbladder. B. Intestine. C. Stomach. D. Esophagus. Answer C. Stomach. This question tests your recall of a common root word related to the digestive system. The root gastro/o consistently refers to the stomach. For instance, gastritis is inflammation of the stomach, and gastroscopy is a visual examination of the stomach. Recognizing this root word helps you understand the anatomical focus of many medical terms in the gastrointestinal system. Always associate gastro/o with the stomach for quick interpretation. Question 9. What is the meaning of the suffix ostomy? A. Incision into. B. Surgical repair. C. Creation of an artificial opening. D. Visual examination of. Answer C. Creation of an artificial opening. This question focuses on a crucial surgical suffix. The suffix ostomy specifically refers to the surgical creation of a permanent or semi-permanent artificial opening, stoma, in an organ or between two organs. For example, a colostomy is the creation of an artificial opening from the colon to the body surface. This differs from otomy, incision, or ectomy, removal. When you see ostomy, think of a newly created mouth or opening. Question 10. The prefix a-/and- typically means A. With or together. B. Against. C. Lack of or without. D. Around. Answer C. Lack of or without. This question tests your understanding of a common negative prefix. The prefix a- or and-, used before a vowel, consistently indicates the absence of, lack of, or without. For example, apnea means without breath, and anemia means without sufficient red blood cells. Recognizing this prefix helps you understand conditions where something is missing or absent. Think of a as absent to remember its meaning. Question 11. Which organ does the root word nephr/o refer to? A. Nerve. B. Kidney. C. Spleen. D. Bladder. Answer B. Kidney. This question assesses your knowledge of a key root word in the urinary system. The root nephr/o consistently refers to the kidney. For example, nephritis is inflammation of the kidney, and nephrectomy is surgical removal of a kidney. This is distinct from ren/o, which also refers to the kidney but is often used in terms like renal artery. Memorizing nephr/o for kidney will be invaluable for coding diagnoses and procedures related to the urinary system. Question 12. In anatomical terms, medial means A. Towards the side. B. Towards the midline of the body. C. Away from the body's surface. D. Closer to the point of origin. Answer, B. Towards the midline of the body. This question tests your understanding of essential directional anatomical terms. Medial refers to a position closer to the imaginary midline that divides the body into equal right and left halves. For example, the nose is medial to the ears. This contrasts with lateral, which means away from the midline. Grasping the meaning of medial is crucial for accurately describing the location of organs, injuries, and surgical sites. Question 13. What is the meaning of the suffix algia? A. Swelling. B. Weakness. C. Pain. D. Numbness. Answer, C. Pain. This question focuses on a common suffix used to describe symptoms. The suffix algia is consistently used to mean pain. For instance, myalgia refers to muscle pain, and neuralgia is nerve pain. Recognizing algia immediately signals that the condition involves discomfort or soreness. This suffix is a quick clue for understanding many pain-related diagnoses. Question 14. The prefix dis- indicates A. Good or normal. B. Difficult or painful. C. Many or much. D. Inside or within. Answer, B. Difficult or painful. This question tests your knowledge of a prefix indicating an abnormal or impaired state. The prefix dis- consistently means difficult, painful, or abnormal. For example, dyspnea means difficult or painful breathing, and dysuria means painful urination. This prefix often points to a functional impairment or discomfort. When you see dis-, think bad or impaired function. Question 15. The root word pulmon/o refers to which body part? A. Heart. B. Blood vessel. C. Lung. D. Brain. Answer, C. Lung. This question assesses your understanding of a key root word for the respiratory system. The root pulmon/o consistently refers to the lung. For example, pulmonary embolism is a blood clot in the lung, and pulmonologist is a physician specializing in lung diseases. This root is vital for coding diagnoses and procedures related to breathing and respiratory health. A quick way to remember is that pulmonary relates directly to your lungs. Question 16. What is the meaning of the suffix pathy? A. Surgical repair. B. Disease or suffering. C. Enlargement. D. Hardening. Answer, B. Disease or suffering. This question focuses on a common suffix indicating a disease state. The suffix pathy consistently means disease or suffering, often referring to a non-inflammatory disease process. For example, neuropathy is a disease of the nerves, and cardiomyopathy is a disease of the heart muscle. When you encounter pathy, it signals that a condition or disorder is affecting an organ or tissue. Question 17. The combining form hem/o or hemat/o refers to A. heart. B. Blood. C. Liver. D. Bone. Answer B. Blood. This question tests your knowledge of a crucial combining form related to bodily fluids. The combining form hem/o or hemat/o consistently refers to blood. For example, hemorrhage is excessive bleeding, and hematology is the study of blood. Understanding this combining form is fundamental for interpreting terms related to the circulatory system and blood disorders. Always link hem/o to blood. Question 18. In anatomical terms, distal means A. Closer to the point of attachment or origin. B. Farther from the point of attachment or origin. C. Towards the back of the body. D. Towards the front of the body. Answer B. Farther from the point of attachment or origin. This question assesses your knowledge of directional terms, specifically for limbs. Distal describes a position further away from the trunk or the point of attachment of a limb. For example, the fingers are distal to the elbow. This term is the opposite of proximal. Clearly understanding distal is essential for accurately describing the location of injuries, fractures, and procedures on the extremities. Question 19. The prefix -, in medical terminology means A. Slow. B. Fast. C. Small. D. Large. Answer B. Fast. This question tests your understanding of prefixes indicating speed or rate. The prefix -, is consistently used to denote fast or rapid. For example, tachycardia means a rapid heart rate, and tachypnea means rapid breathing. This prefix is the direct opposite of brady. Remembering tachy as quickly helps you identify conditions involving increased speed or rate. Question 20. What does the term cholecystectomy mean? A. Incision into the gallbladder. B. Inflammation of the gallbladder. C. Surgical removal of the gallbladder. D. Visual examination of the gallbladder. Answer C. Surgical removal of the gallbladder. This question requires breaking down a complex medical term into its component parts. Cholecyst/o refers to the gallbladder, and ectomy means surgical removal. Therefore, cholecystectomy is the surgical removal of the gallbladder, a very common procedure. Understanding how to dissect such terms into their root, prefix, and suffix is a vital skill for accurate coding. Question 21. The suffix scopy refers to A. Surgical repair. B. Visual examination. C. Surgical creation of an opening. D. Removal of tissue. Answer B. Visual examination. This question focuses on a suffix related to diagnostic procedures. The suffix scopy consistently refers to the visual examination of an internal body structure using an endoscope or scope. For example, colonoscopy is the visual examination of the colon, and arthroscopy is the visual examination of a joint. When you see scopy, think of looking inside with an instrument. Question 22. Which organ does the root word cardi/o refer to? A. Brain. B. Lung. C. Heart. D. Kidney. Answer C. Heart. This question tests your knowledge of a fundamental root word for the cardiovascular system. The root cardi/o consistently refers to the heart. For example, cardiology is the study of the heart, and myocardial refers to the heart muscle. This is one of the most basic and frequently encountered root words in medical terminology. Always associate cardi/o with the heart. Question 23. What does the prefix hypo dash indicate? A. Above normal. B. Below normal. C. Normal. D. Within normal limits. Answer B. Below normal. This question examines your knowledge of prefixes that denote quantity or degree. The prefix hypo dash consistently means deficient, below normal, or low. For example, hypotension means low blood pressure, and hypoglycemia means low blood sugar. Understanding hypo dash and its opposite, hyper dash, is essential for interpreting many diagnostic terms. Think of hypo as under the expected level. Question 24. The combining form cephal/o refers to A. Chest. B. Neck. C. Head. D. Spine. Answer C. Head. This question assesses your knowledge of a combining form related to a major body region. The combining form cephal/o consistently refers to the head. For example, cephalalgia means headache, and microcephaly refers to an abnormally small head. Recognizing this combining form helps you quickly understand terms related to the cranium and brain. Always remember that cephal/o points to the head. Question 25. What does the term arthralgia mean? A. Joint inflammation. B. Joint pain. C. Surgical repair of a joint. D. Bone disease. Answer B. Joint pain. This question requires you to break down a medical term into its components. The root word arthr/o refers to a joint, and the suffix algia means pain. Therefore, arthralgia directly translates to joint pain. This is distinct from arthritis, which would be joint inflammation. Learning to dissect terms into their basic parts allows you to accurately define complex medical words.